Thank you, Dr. Michael White. Good afternoon. My name is Dr. Cirecie West-Olatunji, and you have joined this conversation about trauma-informed care for Black children. What's culture got to do with it? Thank you so much for joining us. We're glad that you're here. What I'd like to do is to introduce the panelists for today. We have Dr. Joyce King, who is serving as our moderator. Since 2004, Joyce Elaine King has been on the faculty at Georgia State University, where she holds the Benjamin E. Mays Endowed Chair for Urban Teaching, Learning, and Leadership. An expert in teacher education and Black culture and education, she has served as president of the American Educational Research Association, AERA, and an academic affairs administrator and faculty at HBCUs and predominantly white colleges and universities. Her publications include 8 books, numerous articles, all on the role of culture and heritage knowledge in curriculum change and global education. Dr. Michael White, whom you just heard. Dr. Michael White is an accomplished, multifaceted New Orleans-based clarinetist, band leader, composer, musicologist, jazz historian, and educator, widely regarded as one of the leading authorities and culture bearers of traditional New Orleans jazz music. Dr. White earned his BA degree in Spanish education from Xavier University of Louisiana, and then went on to receive a PhD in Spanish literature from Tulane University. He currently serves as the Keller Endowed Chair in the Humanities at Xavier University of Louisiana. Dr. White has performed in over 24 foreign countries, played on over 85 recordings, received countless awards, made multiple national television appearances, and been featured in major media publications. Dr. Constance West. Dr. Constance West is a licensed clinical psychologist who specializes in the areas of health clinical psychology and juvenile forensics. Dr. West graduated from Stanford University in May 1989 when she obtained a bachelor's degree in human biology. She obtained her master's and doctoral degrees in health clinical psychology from the University of Miami in 1997 and 1999, respectively. Following graduate school, Dr. West completed a psychology internship program at the University of Alabama at Birmingham and a 2-year NIMH-funded postdoctoral fellowship in HIV/AIDS clinical research through Emory University's School of Medicine. She is in private practice in Atlanta, Georgia. I am Dr. Cirecie West-Olatunji. As I mentioned, I serve as full professor in the counselor education program and at Xavier University, and I'm also director of the Xavier University Center for Traumatic Stress Research. I've received many awards from national organizations. I'm recognized as a fellow in the American Counseling Association. I've initiated clinical research projects focusing on traumatic stress and systemic oppression. My publications include 3 co-authored books, numerous book chapters, and over 50 articles in peer-reviewed journals. I've delivered research papers throughout Asia, Africa, Europe, and the Americas. Finally, we have Meghan Berger, who is a 3rd-year doctoral student in the Rehabilitation Counseling and Rehabilitation Counselor Education Program at North Carolina State A&T University. In 2013, Ms. Berger earned her Bachelor of Science degree in Neuroscience and Psychology at the University of Texas at Dallas. Returning to her hometown, she earned her Master's of Arts in Clinical Mental Health Counseling at Xavier University of Louisiana in 2017. Ms. Berger is a licensed clinical mental health counselor, associate in the state of North Carolina, and she is a national certified counselor. So you can see we have a stellar group of panelists today to share this information. What we're going to do is have a panel discussion led by Dr. Joyce King, And that will go on for about 35 minutes. And then we will open up for questions and answers, and they are being facilitated by Meghan Berger. So she'll be taking a look at the chat, she will be taking a look at the questions, and then she will facilitate our responses to those after the panel discussion. And then we will tell you about our next adventure as we continue this journey of talking about culture-centered trauma-informed care. And then we will end with another selection by Dr. Michael White. And what I'd like to do to start us off before Dr. King begins, if you could in the chat, can you share where you're heralding from today? We want to know, where is everyone coming from? So we would like to see that. And so, oh, I see, yes, oh my goodness, I can see it now from all over. Oh my goodness, absolutely, all over. Wonderful, wonderful. We are so glad to see you all the way from Oregon, Illinois, Georgia, Florida, absolutely. St. Louis, Texas, beautiful. Keep going. We want to see who all is here. So I'm going to turn this over to Dr. King, and we will begin. Dr. King, I believe you're on mute.
Okay, thank you very much. I'm so happy to be here today. It's my honor to be a part of this wonderful launching of this educational series. And I'm going to get right into the conversation with our two distinguished hostesses. The first question I'd like to ask you is, what is trauma? And what is trauma-informed care? Which is why we're all here today.
Okay, well, I'll get us started. I'll start with a very narrow definition of trauma, and I will then pass it off to Dr. West-Olatunji to talk about a more expanded version that we talk about, especially when we look at children of color, particularly African-American children or Black children. So when we talk about trauma, we're talking about exposure to situations that involve a number of different things. So typically we're talking about actual or threatened death, serious injury, or sexual violation. And this could be firsthand, so it could be that you're worried about whether your life could be taken, or you're going to be seriously injured, or that someone will sexually violate you. Or it could be that you witnessed this situation, so you witnessed someone else being victimized in this way. It doesn't have to be that it actually happens. It could be that someone threatened to do so, and it results in a whole chain of reactions, which involve a number of different symptoms that we talk about. So again, it's whether or not the person is exposed to a certain type of situation involving the threats or actual hurt or harm, or even potentially death. And it could be for that individual or for someone who's actually witnessing it.
Thank you, Dr. West. Dr. West-Olatunji, what is trauma and what is trauma-informed care?
Right, so I'd like to continue with this definition around trauma, because my research focuses on traumatic stress, and traumatic stress really extends our understanding of trauma to talk about the pervasiveness of some types of trauma that are not in the DSM. And that's what's used by many, if not all, mental health professionals in being able to categorize what's going on. But when we think about traumatic stress, we're thinking about the everyday kinds of experiences that marginalized people have, culturally and racially marginalized people have, such as Black people, and specifically talking about children and what they experience, that is often unaccounted for, not included in our conceptualization of what's going on, our understanding of environmental factors, such as racism, and how racism is so insidious on an everyday basis. I often talk about children, Black people in general, but children, Black children who wake up to the racism and go to bed with the racism. And so we understand that they are challenged by this and need to have the coping mechanisms for it. when we think about this kind of continuous or pervasiveness of the trauma, we're talking about trauma that is enacted with impunity. So this is what we see when we look at the police brutality, that not only do we have the power and the privilege of racism, we also have a way to enforce it. And that's what the police have been used for. So we have the impunity of it, that it happens without there being any justice. So there's no justice in it happening. And what does that do to Black children when they understand that anything can happen to them at any time and there will be no justice? The idea that trauma is typically talked about as a past event, but traumatic stress in its pervasiveness is talked about in the now and the future. So we have to think about how that thing happens. We also think about the fact that it can happen anywhere, anytime. It's very unexpected the way it happens. And I often talk about how you could just be in a store buying something and everything seems to be okay. And then you encounter a clerk or a cashier who is treating you with these microaggressions. And so your day just went south, went sour as a result of that interaction. So we extend this understanding, the conventional understanding of trauma, to include traumatic stress and how it impacts our children.
That's giving us a real big and deep picture of what is going on. You mentioned the DSM. I will hope that you'll tell the audience, the participants, what that means in case someone doesn't know as you answer this next question. What types of trauma, and you began to talk about this some, but what types of trauma do Black children and adolescents experience? Are there certain types of trauma that are unique to Black children and adolescents?
Yes, what I'd like to do is to give you an example from my practice, and then I'll allow Dr. West-Olatunji to also chime in based on her clinical experiences. So at one time, I had a very thriving practice, a private practice, and saw lots of clients. And I remember I had a client who was from out of state. I mean, not the next state over, like far, and the parent contacted me and said, I had heard that you work very well with children. And so I'd like to tell you what's going on with my child. The child was about 10 years old, in the 5th grade, was in a very small, predominantly white community in the Midwest. And the child was the only Black child in the entire 5th grade, all classes, and was only a handful of Black children at the school. And the child had been experiencing lots of difficulties, behavioral problems and so on, and was referred to the school counselor. But eventually the child was referred out to therapy, and eventually the child was placed on medication by a psychiatrist. The parent, who's very well educated, a professional, was sort of going along with it, not sure what was happening, was uncomfortable, but was trusting the mental health professionals and the educators.
Sure.
But then when the parent began to ask a lot of questions about what was going on, eventually the psychiatrist then recommended that the parent should be on medication.
Yeah.
That's when the parent said, wait a minute, hold up. Something's very wrong with this whole thing, and started asking around and asking people, friends and relatives, who could I go to? What should I do now? And that's how I became involved in it. So the parent flew to New Orleans with the child, and I saw the child, had a session, and then said, okay, yes, I think I can work with you, and I think I can help you to resolve this issue, but I would need to see the child on a regular basis. So it was the end of the school year, and the parents said with all the stuff going on, they could care less whether my child is in school or not. So the parent moved to New Orleans for the summer.
Wow.
And I saw the child over the summer for about 6 or 8 sessions. And the first thing I did was incorporate an understanding of structural racism and educational hegemony, how Western ideals are embedded in the way teachers teach, how they interact with children, how they conceptualize their abilities, what their expectations are for them. and also for school counselors in terms of how they assess, for the mental health professionals to whom the child was referred, how that professional viewed the child, and eventually how the psychiatrist viewed the child and the parent. So I started talking with the child and asking what was going on, because they had said there was suicidal ideation and so on. What the child talked about was the aggressions by peers, how the children were taunting her, calling her names, and so on, and how when the child would tell the teacher these things were happening, it was dismissed, and the child was seen as a problem, was an irritant, was agitating, had a behavior problem, had an attitude problem. At 10 years old, was already becoming an angry Black woman, right? Wow. So, and then when the child finally realized there was gonna be no savior, there was no one coming, the child then began to defend herself. Mm-hmm. And that's when it got worse. So then their perceptions of her just deepened in that sense. Mm-hmm. When she talked about how it made her feel to be treated that way, that's when they started honing in on the suicidal ideation, right? So all of these things, as a result of her being alone, without that critical mass, without anyone who served as support for her, as an ally for her to understand what it means to be the only Black child in the 5th grade, began to erode her self-esteem, began to impact her psychological and emotional well-being, and so on. So what I focused on when I was working with this child was identity, of her having a healthy Black identity. And so that is what we focused on in this. And with that, a lot of her distress was reduced. Some things were eliminated, and she regained interest in her extracurricular activities and so on. The parent decided to move the child to a larger city where there were more children of color in the school. And then the parent commuted to that place until the parent was able to find another job. And she reported a year later that the child was happy, those old issues were no longer there. So the issue is that we need to have the skills to be able to assess what things are contextualized by race and racism, and then what are the tools that we have to restore children to their socio-emotional well-being. So that's my experience from private practice. Maybe Dr. West would like to talk about her experience with forensics or working with children in juvenile justice.
And I wonder, Dr. West, if you could include some focus on the adolescents, the older children. My.
Okay. Well, one of the things that I want to share with you all is just general information, what it was like for me serving as the head of the mental health clinic for a juvenile court. And I did that for 8.5 years. So I served as the head of the mental health clinic at the Fulton County Juvenile Court. So the court that handles the majority of the cases of children and adolescents in the Atlanta, Georgia area, which is a very, very busy court system. And one of the wonderful programs that we had in place was that any parent who wanted to file an unruly petition against their child had to sit through at least one mental health session. So they had to meet with a mental health provider. It used to be they could just file a petition, and we wanted to have a diversion program so that at least a mental health provider could do a quick assessment. So just a quick and dirty assessment of the child and determine whether or not there were other factors explaining the child's behavior other than the child just being unruly. And I can tell you, we saw a lot of different situations, everything from pretty minor infractions. We received a lot of referrals from the school system for children who either were sagging, they wouldn't wear a belt, or children who were being defiant in some ways, everything from not spitting out gum if they were asked to do so. We had parents who brought children in for minor issues such as general talking back, as they describe it, coming home from school late, et cetera. And then of course we had the more severe issues such as battery, sexual assault, and things of that nature. So we would see a little bit of everything. But what was really clear was that oftentimes our children had been traumatized. So the overwhelming majority of these youth were African-American youth, either referred through the school system or by their parents or through the community. And it seemed as though the traumatic nature of their experiences was very much downplayed by the adults in their lives. And so an example that I will provide to you was an example of a young girl, well, it's just adolescent, a young adolescent, I would say about 14 years old, who was brought in by her mother. Her mother reported that the child had been failing to complete her homework assignments, not doing her chores around the home, just basically having changed about 6 months, prior. And talking to the mother, she was at her wit's end because she'd been called by the school numerous times for the child sort of daydreaming in class and not completing assignments, etc. And the way the mom was describing it, it just sounded like it was such a severe issue. And going back and asking, okay, what was going on about 6 months ago? Well, in talking to the child and the mom, it became apparent that the child had witnessed her father be killed. And what she was frequently doing rather than doing her homework is that she had a picture of her father on her bedroom wall, and she would just stare at the picture of her father and cry. And so when her mom would check to see if she'd done her homework, she hadn't. She'd just been sitting there. And without her mom, of course, her mom was also grieving, so she wasn't 100% present in terms of her ability to, really understand what her daughter was going through. And even in talking about that, the mother was sort of like, well, that was 6 months ago. It's kind of like, well, I understand the first couple of weeks, but 6 months is too long for her to still be going through this. And it was really important to inform the mother that it takes a lot longer than that. It can take years sometimes, even for an adult to deal with losing someone, and definitely witnessing the person to die in that manner. It's going to take a whole lot more time, especially if the child is not provided with the support that she needed. And we required at that point that the family receive counseling. It's like, we're not filing an unruly petition unless you tell me that you honestly tried counseling, and we get feedback from the provider, mental health provider, and that you've gone through a certain number of sessions. And if you find that the problems still remain, then you can come back. But we won't file an unruly petition against a child who's been traumatized and grieving. And if we need to interact with the school system, no problem, we'll go to the school. So oftentimes we would go into the school setting and talk to the teachers and help them to understand what the child is experiencing, and helping them to collaborate with the mental health service provider. So oftentimes the mental health service provider can come to the school if you're having difficulty. You call that person rather than kicking the child out or suspending them or whatever. To have the first line of intervention be a mental health intervention, rather than either suspending the child or putting them in detention, or berating the child or spanking the child, or grounding them, etc. Is that we want to identify when a child has been traumatized. We want to acknowledge that, we want to address that, and we want to deal with it. Sometimes there's quite a bit of pushback from either the school system or from parents or the community. Sometimes people prefer to think of a child as being bad rather than being traumatized. I often would call it, the attitude was sort of a, he's not crazy, he's just bad kind of attitude, so lock him up. And it becomes, no, we're not locking this child up. Oftentimes when you find out what a child has gone through, then you say, oh my God, given what you've been through, you're doing great. Like, I can't criticize what you're doing because I can't say that I would handle it as well as you are. And I think even hearing that from someone to say, no, I hear what you're saying about what you've been through. And it's not that you're bad. It's just that you're going through some challenges. You're having a hard time dealing with what you've experienced. And it's our jobs as the adults in your life to acknowledge that and provide you with the support and services that you need, rather than punish you for it.
How fortunate for those children and families to encounter the kind of trauma and informed care that you all have just described. I mean, this is just traumatic, even listening.
Absolutely.
Happening to our children and families on a daily basis. And I just have to say, I'm remembering the recent event in Philadelphia where the family called the police with a husband who was going through some mental health challenge, and the result is the man is dead because there is no mental health trauma informed understanding of the people who are responding.
Right.
Let me ask you, what does culture matter when providing trauma-informed care to Black children and adolescents? Is there a cultural element here that we need to also focus in on? Dr. West-Olatunji?
I'm thinking about Dr. Amos Wilson talking about us staying in our right minds. And he used to say that all the time when I would talk about it. And that really stuck with me in understanding this issue about mental health. About mental health is really about getting into people's heads. Our ability to be effective in working with our clients is our ability to get into their heads, to understand as close as we can, to understand their reality, to understand how they are desperately trying to correct, to self-correct, which is what human beings do. Human beings are wired to self-correct. So the idea is that we can assist and facilitate that if we can understand what we train and talk about phenomenology of being able to really understand their reality. But the problem is when we are trained as educators and mental health professionals and anybody else working with Black children, when we are trained into a particular worldview that is Eurocentric, it's like having a stranger in your brain. How can we help children when our framework is one that's intrusive and one that is counter many times to their own philosophy on life? So that is the real issue. If we truly, truly love these children and we want to help them to be successful in their lives, we have to first unlearn what we have learned and understand what it means to be Black. What is Blackness? What is Black identity? What is the Black philosophy, right? What is Black educational pedagogy? So, you know, it becomes an issue, as you have talked about, Dr. King. What is education for? You have to ask parents, you have to ask community people. You can't ask those books. They're going to give you a different kind of answer. Also in understanding what are children doing, right? How are they positioning themselves as learners? It's based on how they've been raised, how they've been inculcated into certain values that are consistent with what education looks like and is. So it's important for us to go down that road to understand culture. But again, Amos Wilson, we need to stay in our right Black minds. So the idea is understanding how do we get into people's heads and be consistent with who they are, not bring a foreign message about who they should be and what that's about. So, you know, I've learned a lot in working with Dr. White. I'm gonna bring him into this conversation because traditional New Orleans jazz is about resistance. So when we think about our children's behavior is often about resistance to the Eurocentricity in the school setting, you know? And so a lot of their behavior is resistance to that. It's trying to say, I don't relate to this. I don't know what you're talking about. Right? And so on. But, you know, I've learned from him and the music, which is why we wanted him to be a part of this, because that's been his life, to be able to interpret that and talk about how Black people have used our music as a form of resistance. I don't know if you want to weigh in on that, Dr. White.
Yeah, Dr. West-Olatunji. Yeah, Black music has been a form of communication. It's been a form of escape. It's been a form of coping, and it also has been, as you said, a form of resistance. Here in New Orleans, one of the most important values of jazz music is to develop and use your own personal sound and expression, your own voice, your own feelings and emotions, and share those with other people. Now, this music was primarily a fun dance music, and that's what, it was known for, and it spread around the world in that context. But another meaning of the music was it was a way of uh, showing freedom. It was a way of demonstrating democratic ideas and principles, but it was also a way of resisting invisibility. And one of the things I learned as a young musician, I was very fortunate to play with several dozen people born between the late 1890s and 1910.
Oh.
And one of the things that all of those elder musicians talked about was developing your own sound and expression. And at first, I didn't understand that, but I came to realize that that music developed at a time when Black people were considered invisible in society, and speaking out may be an issue and a problem. Having your own identity may be an issue and a problem in the public forum. But through the music, you develop your own sound and your own voice and expression. So you become not only identifiable in a larger public context, but you also gain respect. You're able to compete. You're able to excel. You're able to express emotions through that sound that you might not be able to verbalize safely in public. And it was a way of sharing that with others and expressing those collective needs.
Mm-hmm.
Very well said, Dr. White. I think that we could say that the CRESTS program to achieve is very much in keeping with that very tradition. I don't know if you all want to tell us what CREST stands for and how you decided to express your voice, your healing voice in this way that is a part of our tradition of resistance and liberation. I'm just going to throw it out right there.
Is that me? Would you like me to jump right in? Okay, so CREST stands for Culturally Responsive, Evidence-Based Strategies for Traumatic Stress. And of course, that goes back to the whole issue of being culturally responsive. The answer to what's culture got to do with it, it's got to do with everything. Culture, if you think about it, is one of those things that sometimes it feels like, well, what is culture? What are our cultural values? Sometimes it's hard to put your hand on it, right? Sometimes it's easier when those cultural values are violated in some way. And then we think, oh, okay, that doesn't feel good. That's not right with my soul, so to speak. I remember after I started attending a predominantly white school, I came home and I asked my mom, who's our family? Like, I wanted to know biological family. Like, who is aunt? I want to know which of the aunts, so-called aunts I had, were real aunts versus fake aunts. And my mother was hot because it was like, culturally, it doesn't matter about biology. It's how you function in a person's life, right? And so that's a cultural value, that family is a function of how we actually work, or to the degree to which we're involved with one another. And so it became, those are your real aunts. I'm not going to tell you who's blood and who's not blood, because those are your real aunts. And I remember, like, how am I supposed to go back and tell my teacher? It was a homework assignment. We were supposed to somehow do that. My mother was like, that's not happening. So you tell her I said, that's not going to happen. And it became this whole thing of, okay, when you were in these situations and you're thinking about what's culture, culture determines virtually everything, right? So it's about how we see the world, how we see ourselves. Culture has to do with, even if you think about how we talk, what we say, what we value, what's important to us. When it comes to traumatic experiences, it's going to be it's the lens through which we see the experience. Like, what is that? What happened to me? What does that mean? Culture helps you to define meaning and interpret what that means. What does that mean about me? What does that mean about my people, my family, about people who look like me? Does that mean because people don't want to sit next to me, or don't want me to be their partner when they're studying, or they don't want to be in a group with me, or they don't want to share my clothing or whatever? What does that mean about me? What does that mean about my culture? And what does that mean about my people? Okay, so even the question, if the police will shoot someone, a Black person, a person who looks like me, without provocation, what does that say about my value, right? And what does that mean about us as a people? What does that even mean spiritually? Why would God set something like this up? All of those things are very important. Or why doesn't God intervene? Or is God intervening? Is this an example for us? Culture helps us to understand what's happening to us and help us to interpret what that means. Does that mean it's something on their end, or is it something on my end? And those are all important things. So it's important to consider culture because it is part of everything, like how we walk, talk, move, dance, sing, who we praise, what we believe culturally, what our God is and how we choose to do that. And all of those things are very important factors. How we cope and recover, how we can be resilient is also determined many times by culture. So because what does culture have to do with it? Everything. And it's important that any sort of program that is designed with trauma at the focus of it include culture, not on the periphery as an afterthought, which is often is considered, but in the way in which it's designed and implemented. Every aspect of that program needs to consider culture as opposed to using it as something we just deal with at the end.
Thank you, Dr. West. For whom is the CREST Achieve program designed? Who is it for?
I'll take that.
Okay.
So CREST, that stands for Culturally Responsive Evidence-Based Strategies for Traumatic Stress, is designed for anyone working with Black children. Specifically, we thought about educators, whether they're leaders like principals, superintendents, and so on, or they're educators in the classroom teaching. But it also includes curriculum specialists. It also definitely we're thinking about the cafeteria workers, the disciplinarian, everybody who is in contact with Black children needs to be culturally competent, needs to understand Black identity, Black values, Black worldview, and so on. That's important. We are also talking about the parents of Black children. So we're talking about helping parents to better understand how to engage with the school system. We're talking about parents and helping them to deconstruct maybe how they position their own children and so on, because we understand that that's a reality as well. So we also, someone asked in the chat or one of the questions about selecting mental health professionals. We want to talk to parents about that. What should you look for in selecting a mental health professional to work with members of your family and yourself? So we want to not only train people so that they're more competent, but also work with parents to be able to help them. And I'm glad that I'm talking because it's actually time for us to open it up completely, because this is a conversation where we're all engaged and talking. I saw someone asked about what resources. It was lovely. Someone started providing books that they could purchase. I know we've got some librarians out there. We got some community organizers out there who already know the deal. So we are using our community resources this afternoon. So I'm gonna now turn this over to Meghan, who is going to facilitate the questions, and we will all try to answer because we have a lot to offer. Yes.
You're due.
Yes, thank you. Thank you. And thank you for such a synergistic conversation about our Black youth. And thank you all for the panelists here today. Ramona in the chat asked, what does this imply for caretakers, counselors resolving issues of culture from a different culture from the child? For example, we who are Black feel and have experienced situations referenced by the panel. So I guess, how do we help those who come from a different culture working with the children? And who would like to answer? Oh, Dr. West, yes.
I guess that's me. So the first thing, of course, is to make sure that it takes a lot of humility to deal with situations of this nature, because you have to understand that even if you're African American or Black, doesn't mean that you all automatically understand cultural issues and how to consider cultural factors in the implementation. It gives you a head start, but it doesn't necessarily mean that that's something that you are really actually adept at doing. And especially when you're talking about even within amongst Black people or African Americans, there are a lot of different cultural groups. We have people from all over. Even if you just talk about North versus South or out West, or you talk about higher education and income versus lower, you could be talking about people who may be from the Caribbean or from Africa, and then it becomes, that's a whole nother level because you're talking about not a lot of different cultural groups. So it becomes this whole thing of no matter who you are, you need to be humble enough and have humility to say, I may not completely understand, right? So I need you to tell me, you know, how you see this. How does this, you know, tell me about your cultural values. Even if you don't say it that way, but you may say, okay, so from your standpoint, you know, what do you normally do? How do you normally cope with things? What's traditional for you? Like, so going into kind of understanding, like, how have you coped, which is really helpful. How have you dealt with things? I mean, anybody who's a Black person, if you're Black in America, you have had some traumatic experiences. And if you're any person that has, typically most people have had some sort of traumatic experience, but especially for people of color in America, and particularly African American Black people. So it becomes, okay, let's just talk about how have you dealt with the different things that you've experienced? What helped you get through? You know, and that's an important piece. And one of the reasons, I mean, in private practice, the name of my company is Sankofa. And Sankofa is about going back to get what's valuable from your past and bringing it forward for the present time and the future. And what's important about that is being able to think about, either from your own standpoint, what have you used from a cultural standpoint to help you get through what you've gone through? And then we as a people, what have we done traditionally? What have we relied upon to help us get through hard times? We've been through a lot, I mean, and so because we have the power of resilience, right? And so we are by nature, we're the people who made it through everything we've been through. So this is not new to us, to be able to deal with traumatic experiences. So we want to learn from those things. And so we don't have to reinvent something. We want to bring that back. You know, what did grandmama and great-granddaddy do? We want to pull that through and to use that. And then we want to build upon that. So we won't necessarily give somebody something totally new that's based upon a different cultural group. It's about being about, what are your cultural values? What have you done? And then it becomes understanding that and being able to be humble enough to get the information that you need. And then incorporate that into their treatment plan. So you're not giving them something that is coming from the outside, that they have to try to flip their mind to understand what you're talking about, right? It's something that's consistent with who they are. And so it's about being humble and learning from your clients, learning from your peers, other colleagues who have worked with this population and or maybe from that background. And then being able to use that rather than thinking, I already know what you ought to do, and then I'm going to give it to you and teach you how to become an acrobat so you can jump through all the hoops you have to understand and utilize that. When I can just take what you already use, build upon that, and help strengthen that and foster that so that you can be successful. And that's how you deal with cross-cultural issues.
That might be a place to also add what it means to be evidence-based. I just throw that out because that's part of what you all are talking about. And I don't know if anybody in the chat has mentioned that, but I would be interested in hearing you say something about evidence-based.
Right, exactly. So one of the things that I learned from Dr. Asa Hilliard is about the idea of scholarship and the idea of being tight with whatever it is that you're talking about, and making sure that whatever it is that you're saying is built upon solid evidence, and that you're not just talking, you're not just you know, theorizing and pontificating about things, that it's based upon research. But one of the things that we understand about being in the academy is that oftentimes the research that's out there is very pejorative. People are making a lot of money off of, I was thinking poverty porn because I just watched the movie 40-Year-Old Version. The idea that that's being sold, this idea of Black people in poverty and, you know, this deficit-oriented way of conducting research. And I remember when I was at a predominantly white institution working with doctoral students across a lot of disciplines, a lot of times when they first did their search came back with just a plethora of deficit-oriented research. And thanks to a lot of people who mentored me, like Dr. King, it's like I would tell those students, no, go back and do it again. You're gonna have to go beneath that sea of research that is talking about you and your mama, to go beneath that to find the researchers who are really engaged in using emancipatory methods to really get at a deeper truth. And so once you're able to do that, so that's what we've done. We've gone beneath that to take a look at the research that's out there that is conducted about Black youth, where we understand the interventions are those that have been shown to be effective in working with Black youth. And so not some of the stuff we see, which is that research is done predominantly on other groups, usually on white students with only a few students of color. And then the authors then want to tout knowledge about working with Black and brown children. And so we didn't want to do that. So all of the interventions that we talk about in the training that we've developed and the webinars that we're presenting are based upon research studies that have been conducted on Black youth and have been shown to be effective in working with Black youth using a Black framework, Black worldview.
Thank you, Dr. West-Olatunji. I'd like to return back to the Q&A. We have a few questions, and it seems like I would like to just quote, I run a sports leadership program, and this is going back to the evidence-based question and trying to alter that master narrative and that dominant narrative that we have. I run a sport leadership program for incarcerated male youth, primarily Black males. While sport is an evidence-based technique for fostering important leadership skills, it's also culturally a challenging, complex space for Black males. I sometimes feel like I'm feeding the narrative, sport is the only way for you to make it in life. Any advice for how to support and empower their interests, but help them envision other possible futures?
Yeah, so one of the things I would recommend to our attendee, I think it's Jen, is to go and find the research. There are actually STEM researchers who are developing research around Black athletes and getting them to be STEM majors, and they are very successful. So you need to take a look. I think some of those are out in California where they're working on some of those projects. So they're, again, evidence-based, again, countering that narrative about, because we often think that if, you say, Black athletes and you say STEM, it's like an oxymoron. Those two things don't go together. They can't be a scientist and also a Black athlete. But here we have people doing research that is exactly about that. That doesn't get in the news, and that is not what educators are talking about when they work with our children, but it is a truth, it's a reality, it's going on. So I would encourage you to do a Google search. Like I said, when you start, it always starts with that sea of stuff. But if you keep looking and you keep following the research, you will begin to see where people are engaged in that research. So I would say, yes, there's a lot of stereotypes about Black males in sports, but there are some people doing research where they're pairing that stereotype and countering it by getting them to be amazing science researchers and practitioners.
Yeah, oftentimes it's important to sort of say where people are and what they're interested in at the time, right? And that's sort of your hook. So a lot of times, even with mental health, a lot of times, I'm accustomed to providing mental health services in places where people aren't exactly looking for mental health services. So at the court, they're not coming for mental health services, but we end up selling it. In medical settings, oftentimes I've worked in clinics, especially working with clients who are living with HIV, they weren't coming in for mental health services, but it's like, oh, while you're here, we're doing a screening, or I'm telling you about various programs. And it could be that you could set whatever people are interested in. That's how you kind of get access to them. And then you start finding out, okay, some of these people also have a lot of other gifts, whether it's musical talents, whether it's, whatever. So it's sort of like whatever people like to do, that's where you start. But while you're there, it becomes this whole issue of introducing ideas. So it becomes, actually, there's a lot of physics associated with basketball, right? So it becomes, all right, well, let me tell you, let's talk about what that looks like. And you can be, especially if you want to be an athlete, it takes a lot you have to think about those types of things. So I think that making it clear that there's STEM implicit, okay, in some of these activities that people like. And so it ends up being, okay, well, let's talk about that and explore that. Because I think that if you can kind of go with what people are already interested in, and you can link it to some other things that are relevant or important, I think there's a whole lot more room for you to sort of get them sort of turned on to some other things that were maybe more academically focused.
Thank you, Dr. West, and thank you, Dr. West-Olatunji. I think we have another question, and shifting our conversation back, there was a story earlier on a child being given medication when it wasn't needed. And could you recommend any articles, books, studies, or at least direct us in where to find information about the misdiagnosis according to the DSM due to not considering the cultural differences?
Off the top of my head.
There are several books on Black psychology, so I would start you there and beginning to read and becoming knowledgeable about all of these authors who are either behavioral scientists or they're practicing mental health professionals who are writing about all aspects of mental health with Black children, Black families, Black couples, and so on, to allow us to begin thinking about how we interact with and how we work with our clients around medication. There's been lots of discussion since, several decades ago with the ADHD and the medication being given to children. What we need to be educated. There's no way of getting around it. We need to talk to parents about educating themselves about the medication instead of just taking it or allowing their children to be on it. They need to go and research about the medication. That information is freely available, and they can just ask more questions about it to understand where is it being used? Is it only being used in the US? Is it banned in other countries? Should we ask those questions about why in the US they're offering it? How prevalent is it in the Black community versus other communities? Are there behavioral interventions that could be used prior to? So I often think about medication as being sort of the last resort when we've tried everything, when often for Black children, it's the first choice, not the last choice. And so there isn't that consideration and conceptualization of what could be the other factors involved. And so I would say that. We have 1 minute left to our questions.
Oh my goodness.
Dr. West would like to also answer the question about medication.
Yeah, I mean, there are very few conditions. I mean, I would think about psychotic disorders in particular, especially in the absence of depression, that would really indicate that medication is going to be the first line. Most of the time, though, it's going to be important to make sure that you've ruled out the impact of trauma, right? And keep in mind that oftentimes the majority of children actually are diagnosed by their medical provider, so their pediatrician, right? Keep in mind, oftentimes medical doctors don't spend as much time with individuals as mental health providers. We usually spend at least 50 to 90 minutes with the family, right? And we're including a lot of records. Physicians don't get to spend that much time typically. And so it's going to be important that even if your pediatrician has made a diagnosis, that you also make sure the child has a very thorough workup with a mental health provider, and to see whether or not there's agreement in terms of the diagnosis. And at that point, typically, for most conditions, I would say for children, at least, children and adolescents, therapy has been demonstrated to be just as effective as most medications, right, or counseling. And so depending on the condition, given that it's most conditions, it would be important to start there. And if you need to fold in medications, that's something to consider, okay? So it's important to at least make sure, number one, the child is not just diagnosed by their medical provider, that it's in conjunction with a mental health provider. And then finding out whether that mental health provider feels as though he or she can make a difference in terms of the symptoms without including medications. And then at that point, if it seems to be indicated by all providers, then that's going to be something to consider. Now, sometimes I have people come in and I say, oh, no, we absolutely have to get this child on medication. But that is pretty rare. Like I said, it's mostly in terms of psychotic symptoms in the absence of depression. Typically, though, we can make a big difference in terms of the child's behavior. And even if we increase it, so it's not just individual therapy, we can add in family therapy or group therapy or school-based interventions and things of that nature before we think about medications, typically.
All right. Well, thank you so much for, we are coming down to the end, we're almost at the end of our hour. We wanted to tell you that we're continuing this conversation. So I want to share my screen and share with you our next venture, and this is Culture Centered Mondays in November. So at the same hour, for the next 4 weeks, we're going to continue the conversation. We're going to talk about how systemic oppression and structural racism affect the everyday lives of Black children. Take a walk in our shoes. We're going to talk about excising structural racism from the educational and home settings, reinterpreting Black children's behavior, and promoting resilience and high academic achievement. It says $79 for all 4 lectures, but Meghan is putting in a discount code for you. So for everybody who is present today, or who even registered for today, will get the discount code, and for you to be $49 for all 4 of the webinars. So we want to continue, but what we really want is to be able to develop a cadre of people, educators, mental health professionals, parents, who really understand how to use culture, who understand what culture has to do with it in raising and promoting excellence among Black children. We want to tell you that this session is being recorded and it will be uploaded to YouTube. You will get a link to it. We hope to have it up by this evening, actually. We hope that you can use it for your classes, share with colleagues, family members, neighbors, coworkers, anyone at all. So we're hoping that you will continue to work with us as we do this. We want to thank Dr. Joyce King for her time and her brilliance to be able to be with us, to deepen the conversation. Thank you, Dr. Michael White. He's gonna close us out shortly. And Meghan, thank you so much for facilitating the chat and the questions and answers. You did a great, great job. Yeah. And now this is the end of our program.
Dr. West, yes. Sorry, before you go, there are 2 things I wanted to answer. One is, will there be certificates of attendance? Yes, for the rest of the lectures, we absolutely will do that. People are asking about how they can go ahead and register. Do you want to share that with them?
Yeah, so you can go on Eventbrite and you can connect to that, but because you were here, we're gonna send out a follow-up to you with a link to it. You could go on our website, which is CRESTprograms.com. Go to the website, there's a link there. So you can go back to Eventbrite, you can go to our website, you can wait for the email to come out, but you're going to get a link to it. If not, contact me. Either by email, whatever, reach out to me and I'll help you out. All right, so thank you all so much. And I'm gonna turn it over to Dr. White and I will mute myself so you can really enjoy his closing. Thank you so much.